Good afternoon. My name is Sarah Hirschman. I'm a doctor of physical therapy student at the University of St. Augustine. How are you today?
Good.
Good. Can I go ahead and get your name and full date of birth?
Yeah, Matt Wesley, November 7th, 1993.
Okay, I'm just going to go ahead and verify that here on your tag. Perfect. Do you know where you are today, Matt?
Yes, we're in Coral Gables, Florida, University of St. Augustine.
Okay, and do you know what today's date is?
Yes, March 13th.
Perfect. Okay, so I read in your chart that you're coming in here for a C3, C4 lateral stenosis, which is causing a lot of pain. Does that sound familiar to you?
Yes.
Okay, if you could rate your pain today on a scale of 0 to 10, 0 being no pain at all, 10 being like I need to go to the emergency room right now, where would you fall?
I'd say 6 out of 10.
Okay, so we definitely want to get that down before we proceed with our treatment today. So what I want to start with is something that we call cervical traction. And what that is we're just going to get you on this table. I'm going to put you into our little headpiece here. We're going to fix it at an angle of pull that suits you, and it's just going to give you a little bit of pain relief and get some range of motion back. Specifically what it does, it's going to increase the space in between your vertebrae, and then it's also going to elongate some of the muscles or muscle tissue that's around your neck, so that should help alleviate some of your pain. Does that sound okay with you?
Yeah.
Okay, perfect. And if at any point during this you get uncomfortable, we can always stop and do any other intervention. We have plenty to choose from, so just let me know if you feel uncomfortable at any time. Before I get you onto the table, I do want to go over some precautions and contraindications with you, which is just making sure that you're clear for the treatment. So do you have any history of whiplash, cancer, or OA?
No.
Okay, and do you have any claustrophobia issues or COPD at all?
Nope.
Okay, perfect. So we're good to go for treatment. I am going to do a little bit of a skin inspection on the back of your neck just to make sure that you don't have any wounds or anything that could get hurt during this treatment, and you look good. So if you want to go ahead and get up and take your shoes off, and I'll help you onto the bed and get you all situated into our traction machine. Under here so I don't trip. Okay, I'll just ease you back into here. Alright, so I'm going to put this headpiece on. It's just going to go right over your forehead. And I want it to be pretty snug, so let me know when that's getting snug.
Right,
okay. And then I'm also going to place this stool under your feet so that we're comfortable. Perfect. Feeling okay?
Mm-hmm.
Okay, so what I'm going to do next is I'm just going to explain the parameters that we're going to do. So since you're C3, C4, the level that we're at, I want to just do about a 10-degree pull of flexion. So I'm actually going to raise the table just a little bit. Okay, does it feel okay?
Mm-hmm.
Okay, and then next, since you're having, since it's lateral stenosis and we're trying to get that pain down, we're gonna do what's called intermittent, and it's 3 to 1, so it's about 45 seconds off, 45 seconds on, 15 off. So that just means you're gonna be at a pull for about 45 seconds, and then the rest of the time you'll be relaxed. A few things before I tighten these, because once I tighten these, we prefer that you don't talk. So we're just gonna do a thumbs up method, thumbs down when that happens, but I'm going to place a call bell right by your side, and I'm going to put your hand here so you know where that is. And then also we have a stop treatment button, so if you're uncomfortable, feeling way too much pain or something at any point during this treatment, just go ahead and press this. And that call bell is also there for your safety. If you have any questions, concerns, because I will be stepping away for just a minute, you can go ahead and reach that. Do you have any questions for me? Okay, so what I'm going to do now is I'm going to tighten this. Okay, perfect. So now I'm just going to do the rope release so that I can connect you. And our treatment time today, Matt, is going to be about 15 to 20 minutes, okay? But I'll be back to check on you. All right. So I'm just going to go ahead and set my timer, and we're ready to go, okay? How we doing, Matt? All right, our time is up. I'm just gonna go ahead and release that. Don't want it to jerk you back. Okay. So I'm just going to release this, and when I release this, I don't want you to get up right away. We're gonna have you lay down for about 5 minutes, just to prevent any dizziness. This off. Feeling okay? Okay. I'm gonna go ahead and take this away so you have some space. And if you could use that same scale that I told you about before, what would your pain level be right now?
I'd say it's like at a 3 now.
Okay, alright. So I'm also gonna take this away. Go ahead and lower your hands back. Alright. So I'm glad that that pain's down. Are you ready to sit up? Okay, and we're gonna do, on the count of 3, 1, 2, 3. Perfect. So now we're just gonna work on some scapular retraction to finish out the rest of our session, okay?